Good afternoon, everybody, and thank you for joining us for another one of our MAG educational seminars. Thank you for making the time to join us on this, what in Sydney is a little bit of an unusual day. Can't make its mind up whether it's cloudy or sunny. Today, I am joined by the very lovely Dr. Paul Nichols, dental surgeon extraordinaire. And Paul and I are going to present together to you on the topic of how to prepare a good letter of instruction. Now, the reasons for this are many. Dr. Nichols has already presented on this topic to you, and I would urge you to revisit that session, which has some much more particular to dental and particular to matters where X-rays and imaging are concerned. I would urge you to revisit that on our YouTube channel. But again, we are both encountering letters of instruction every day, and we see that there really needs to be some support to make sure that you're getting the very best out of the specialists that you're engaging for your matters. So Paul's probably going to do most of the presentation, but I just wanted to highlight here on our first screen that our experience together has provided us with the insight on what can assist you to provide a high quality letter of instruction or referral letter, depending on what kind of organisation you work for. They're often called different things. We're going to present to you on how to write a letter that talks to the kind of assessment you want and the information that you need to share with the specialist. So you really need to be telling them what kind of assessment you're asking for. What is it that you want to be in the doctor's mind when they are doing the assessment? They obviously need to know what happened to the person. Why is it that they're before you? The nature of the injury, how the injury occurred, what you're asking them to assess and consider, and that includes what you don't want the doctor to comment on. Why you want the person to be assessed, what information you want the specialist to take into account, and as I said, what you don't want them to comment on. It's so important. And the reason for that is that particularly in certain matters, commenting on something outside of the scope of the subject injury can affect the way the matter is progressed in a legal context and can also reset dates in an insurance matter. And not all specialists are aware of that, particularly if they're a specialty that doesn't report as frequently perhaps as others. For example, psychs and orthos are presenting all the time, but a dermatologist is perhaps not doing as many assessments. And they might think that by chipping in and offering this extra comment, they're helping you, but in actual fact, they're not. So that's why it is important to be really clear about that information. I've just put this graphic in because it made me laugh. Especially in relation to the gazetted rate or fixed fee matters, don't be providing the doctor with crates and crates and crates of paperwork. They don't have time for that, and the fees are really not, don't really cover them for that amount of reading time. It's really important that you do the work at your end so that what you provide to the doctor is relevant and appropriate to the matter that's about to be assessed. So over to you, Dr. Paul.
Thank you, Michelle. It's a privilege to be here to talk to you and to try and have MAG present the best quality LOIs, because that's when you get the best quality reports. Now, if we go back to the one with the chap covered in references, this is probably a key one. You may not be aware that the PIC have recently introduced a 500-page limit on the applications for consideration of PIC. And this will be introduced into most medico-legal reporting exercises in the future. So you'll need to get used to summarising some things, but mainly just providing 500 pages of what the case is all about. For instance, I'm a dentist, but I'm speaking on behalf of every expert. If, say, you've got something simple like a broken tooth, we don't need masses of psychological reports and hospital reports. We do need to know what happened in the hospital, whether there's any treatment, but apart from that, I don't need to know who fixed the broken leg or whatever. So keep that in mind. Keep your LOIs, the bundles, down to less than 500 pages.
Magic.
The main thing for the expert witness is timeliness. We need to get the LOI a minimum of a week before we get to see the patient, because we need a chance to read through the masses of paperwork sometimes, and we need to prepare a summary sheet of what questions we're going to ask that particular claimant. If we go the night before the appointment, it's just not going to work. We just don't have the time or the ability to prepare so that we ask the right questions and therefore get the right report. So if you keep that in mind, tell your clients, that are the lawyers and the case managers who are doing the LOI, that they must have it completed, prepared, and presented to you so you can present it to the expert with a minimum of a week. If I can get my LOIs 2 weeks before, I'm very happy, because it gives me time to think about it. I can sleep on it when I think of things while I'm asleep. And it'll give me time to actually ring treating dentists if there's any discrepancies in what's been proposed and claimed. And then you get a much more useful report for the client.
Mm. And also on that, Dr. Paul, too, if you get the paperwork in advance, it gives you the opportunity to have a look at it and actually to then decide if this is outside of your scope of expertise. And much better for the lawyer or case manager to find that out well and truly before the appointment than on the day or the night before, and then to have to inconvenience the claimant and pay a cancellation fee because the paperwork was so late the doctor didn't have a chance to see whether they could even do that assessment.
Exactly. And there are cases where if I get the LOI in good time, and it's quite obvious that this case will have to go to another specialist, then I can call you back and say, look, I've got your LOI, thank you, but I think that I can be useful in giving you the medico-legal opinions, but I'll need to get the opinion of another specialist before I can do that. You know, in other words, that claimant needs to see the specialist before they see me. If you haven't got at least a week to arrange that, then everything has to be postponed and cancelled, and it's messy.
Absolutely.
But we could go back there. Now we've got the important issue of the pre-incident records. This is one of the weaknesses of most LOIs and most bundles of evidence, is that there has been no effort made to get the pre-incident records. Now, sometimes there won't be any, of course, because the patient's never seen a dentist before or an eye specialist before or whatever. But you have to make the effort to discover whether they are, and that's simply a matter of asking the claimant, have you seen a dentist before? And if they have, then you must search for those records. If there are no records, then I'm quite entitled to make an opinion without them. Just by looking at the patient, you can sometimes tell what sort of a history they've had. But it's better to have the written records and the x-rays, because I can't see under the teeth sometimes, and most specialists will need x-rays before the accident. So we can say, that's what they were like before, that's what they were like after. See this? That was obviously caused by the accident. Or no, that wasn't, because it's still the same. So those pre-accident records are vital. Also the time of injury, of course, because we need to know. But they're usually easy to get because they go to hospital and have x-rays taken. And the discharge summaries from the hospitals, what were they discharged with? Quite often I say the patient was advised to see a dentist or see a specialist orthopod, something like that.
Yeah. That's yours too.
Ah, yes. Now, we all have in this business a duty of care to mitigate against further damage. And that just means timeliness. We have to get to the appropriate treatment to the claimants in good time. If that doesn't happen, then there's trouble for the managers if it goes to court. Because any further damage that's done, for instance, if a tooth isn't treated immediately, then the nerve will die. And instead of having a simple filling for a couple of $100, you've got a root canal therapy and a crown and all sorts of things for up to $5,000. And the insurance companies going to want to know who to blame for that. And if you haven't presented the information to the specialists in good time, and then they're going to be chasing you. So very important to remember that we all have a duty to mitigate against further damage or injury. And then the appointment, of course, must be made as soon as possible. Once you get everything together, get the bundle ready and the LOI, and present it as soon as possible, so we can get on with it and mitigate against further damage. And be clear about there, provide the paperwork put on in advance. I think we've been through that.
Yeah, look, just on the be clear about any deadlines such as court dates. I've seen on a number of occasions letters of instruction which have no detail at all about an upcoming deadline. And then all of a sudden, the doctor thinks they've got the usual couple of weeks to get the report. And we receive a frantic call from a case manager or a lawyer saying, but we've got a settlement conference on Thursday. Now, if you have urgent deadlines, either a statutory time period associated with this compensation scheme or a legal deadline, make sure you put that clearly in the letter of instruction so the doctor knows. Because if they don't know, they can't respond to your timeline. And if you all of a sudden present that urgent date, then the work they do won't be, well, you know, our doctors are pretty fabulous, but there's a chance that they mayn't be able to do as thorough a deal if they're having to meet a short deadline.
It's a very important point. For instance, if I know that there's a court case coming up or whatever, and I know that the pre-incident documentation is going to be important, and I can't make a comment on causation until I get the pre-incident documentation, then I can ring you straight away and say, look, it's not going to work. You're going to have to postpone. The lawyers have to postpone that settlement until all of the experts have access to the pre-incident records. Otherwise, it can't be done. And they'll have to put off in supplementary reports, and then of course the costs go up.
Absolutely. And look, the last 2 points on that one there, really important. And sadly, we see this a lot of the time in our rooms. Make sure that your claimant or injured worker, injured person knows, A, the fact that you have booked an assessment for them, that they know why you have booked an assessment for them, and that you've spoken to them about how they're going to get there so that they'll be on time. This is particularly for people who live in regional areas who are having to travel, for example, to a big city. Perhaps they don't ever go to the city. Perhaps they don't know it well. You're going to need to help them with some ideas about making sure they book a train or a taxi or get a lift or drive in time to get there and find parking. So that's so important. Nothing more frustrating than to have a person turn up and they've already missed their appointment. They often expect the doctor to just be sitting there waiting and able to slot them in, but that is not the case. Doctors work on a schedule, and so it often means a wasted trip for the person. Similarly, when the appointment is by video link, it's really important that you speak to your claimant or your worker and remind them to have correct technology, ideally a laptop or a desktop computer. A phone is not ideal for most consults, and doctors don't like video phone consults. But in any event, they need to test their technology before the assessment and make sure that the link works so that on the day it can go ahead smoothly.
Just further to that, I would say 1 in 5 claimants I see just have a standard letter of instruction to go for a medical assessment. So when they get to see me, I say, have you bought your dental x-rays? And they say, well, I didn't know I was seeing a dentist today. It just says medical assessment. They show me the letter and it says medical assessment because the case manager has not changed the template for informing patients of their appointments.
So important. So important. All righty. Moving on. LOI basics. Off to you.
Well, there we are. So you need to change your pro forms when you're informing both the patient and the expert witness. In your LOI, it's amazing how often it's a she when it should be a he. And it just makes the expert stop and think, what is going on here? And sometimes I have to make a phone call just to make sure that the person coming is in fact a he. You change the terminology. You don't just say medical assessment. Very rarely would you say medical assessment. You have to say a dentist or a psych or an orthopod or a dermatologist or whatever. And use a font that can be easily read, because most of the experts are like me. They're getting on a bit now, and we can't read fine print. So it has to be, in my view, it has to be bigger than 11 so that we can read it easily. And address the letter, not just to dear doctor, but, you know, give us the courtesy of addressing us by our full name.
Yeah, absolutely. Continuing on from LOI basics, make sure that your name or the lawyer or senior case manager on whose behalf you are writing it is clearly shown in the letter, so that the doctor can address their report correctly to the right recipient. Also, so that the doctor can make contact with you or that person if they need to. As Dr. Nichols has explained, sometimes they need to double check something or advise that further documentation is required. This is one that I hear the next question down. Don't ask the same question more than once. The LOI is not a psych test, and you're not trying to trick the doctor out and see whether they'll give a different answer. They are medically qualified or dentally qualified. They are qualified healthcare professionals, and they know what they're doing. Just ask clean, clear questions once each.
Exactly. Well, the best thing to do is just ask one question. Is the injury and the resulting proposed treatment have a causal relationship to the incident? That's all you need to do. That's causation. You're asking about causation. Did the accident cause the need for treatment? And that's it. Sometimes there's 3 or 4 different ways of asking that, and they're all down there. You know, it'll say, what's the causation of the incident? It'll say, what relationship does it have to the workplace? And it'll say, you know, what relationship does it have to the previous medical record? You can ask all that in one question. Right? What is the relationship between the injuries claimed and causation?
Absolutely. Yeah. And Dr. Nichols has already touched on our next point. If you are using a pro forma referral or LOI document, and a lot of businesses have gone to great efforts to create templates or pro forma documents, go through it and delete the questions that are not relevant to your client's injury. So if you are addressing to a dentist, again, there's no need to put the mental state or mental health questions in the letter. If you're going to an orthopedic surgeon, they don't need to know about the tonsillectomy or the hearing loss. So remove any questions that are not relevant to that specialist. And furthermore, medical specialists can't comment on home care needs. That requires an assessment by an occupational therapist. Those are the people who can look at somebody's functionality and activities of daily life. It's not the role of a medical specialist to talk about how much it will cost to have a gardener come in and do the lawn because he's had a hip replacement, or whether he can cook his food or load the dishwasher. So we see this a lot. It's almost like people are trying to get 2 reports for the price of one, but it's out of respect for the specialist. You're asking for their expertise in their specialty. They can't comment on matters that are outside of their medical specialty.
One thing I normally say is, look, when you're doing your LOI, if there's more than 6 questions, you need to have a good look. If those 10 questions are really necessary. Maybe they will be, but you need to check, and a lot of composers of LOIs do not check that all the questions are essential.
Good point. This one's for you.
Give the expert some background here. Just assess the case and find out as much about the case as you can, so that I'm in the right frame of mind when I see the patient. I know that they're a mother, or I know that they're elderly or whatever, and I'm ready to ask the right questions. And summarise the incident, the injuries and the claims. So I've got some idea, was it a car accident, was it a work, was it a head injury, or was it secondary to some the dental problem was secondary to some other major injury. For physical injuries, you don't need to send psychiatric reports to the specialist. You've got to be sure about that, though. That means understanding the claimant, because sometimes psychiatric injuries can cause physical injuries, but mostly they don't. So just have a good look at it yourself. Now, do they really need to have these 14 psychiatrist reports? Because as we know, psychiatrist reports are 3 times as long as anybody else's reports. And the reading time goes up.
Yeah, absolutely.
Don't send the person's entire medical history, only what's relevant to the case. I don't, as a dentist, for instance, I don't know, they broke their foot 16 years ago.
I'll never forget seeing a bundle of documents provided to, it was a psychiatric assessment, and in the bundle of documents, which was almost a milk crate worth, there was 10 pages devoted to when the claimant, who was a man, had attended at the hospital with his wife to give birth, and she had laboured for 2 days before finally having a forceps delivery of a healthy baby. And that was included and this child, of course, was now in their teens, and that was included to the psychiatrist for this man that 14 years ago his wife had a baby. Not relevant. Now, this is a big bugbear. All the doctors tell me this one. Oh, my goodness.
It's a pain in the neck. Really.
So make sure all of the pages that you supply in your PDF document or however you supply it, make sure all the pages are facing the right way up. If you scan documents, scan them straight, not crooked. Don't send double-sided paperwork if you're sending hard copy paperwork. I have not met one specialist who likes double-sided paper. It is an absolute pain. It also doesn't trick the page counter on any of the apps that count pages to record reading time. So just don't do it. Make sure that the paperwork is in chronological order. The doctor should not be having to chop and change and trying to piece together the story themselves. It should come as a flow in proper order. And when including hospital notes and discharge summaries, cull the observations. Don't make the specialist have to do it. It's not their job. You will have paralegals or junior people in your office who can do this. It's just respect to the specialist. If there are 300 pages where the nurse goes in every hour, checks their blood pressure, asks if they need a Panadol and whether they've gone to the toilet, the doctor does not need to see that. Now, if there are multiple injuries and you are having other specialists assess them as well, don't include specialist reports that are irrelevant. So, as we've already spoken, the dentist doesn't need to know about the foot injury.
Unless the foot surgeon thinks that the foot's been bitten.
Touche.
Yeah, actually.
Now, this is some privacy and data stuff that, again, we do see, unfortunately, far too often. Don't include information in the bundle of documents that relate to another worker, client, or person that you are dealing with. That does constitute a privacy breach, and it can be a multiple privacy breach because that information goes through several layers of people before it gets to the doctor. So please make sure that you are only including the papers for that individual. When you are sending photocopies of x-rays, oh my God, this is one of yours, total bugbear.
The thing about this is that you can't photocopy an x-ray. And you need to look at the bundle. And if you find an x-ray that you can't see a tooth or a bone or whatever in, then neither can the expert. But if you can't read the x-ray, neither can the expert. And you just have to send it back and say, I'm sorry, you'll need to send the digital copy or the original x-ray if they're still taking analog x-rays. Nearly everything's digital now. The problem with digital is that you have to be an IT expert to have it labelled and dated properly. I get so many really good x-rays, but there's no name or date. And I'm supposed to work out from the records when it might have been taken. So if you get any of that, send them back and say, I'm sorry, those they can't be admitted as evidence in court anyway. Anything that's not labelled or dated can't be used in evidence in a court. because it could be their mother or their brother or
Exactly.
whatever.
Yeah. I'm just going to quickly show you the next slide.
Oh, yes, right. Yeah.
Have a look at this, guys. I can't tell you again how many times we have received this. Now, we all know the notorious jokes about how terrible doctors' handwriting is, and particularly for our older specialists, when they went to uni and learned medicine, there was no such thing as laptops or even typewriters or portable things, and they had to learn to write real fast in handwriting, and that's why their handwriting is terrible. Often they can't even read their own handwriting. My sister's a doctor, and if she sends me a letter, the only thing I'm ever sure of is the first two words are "Dear Michelle." Now, if you can't decipher it, then neither can the specialist, the same as the X-ray. So you've got a couple of options if this happens. When amongst the bundle of papers that you are going to present to the specialist is something like this, blow it up and see if by blowing it up using your photocopier, it's clearer. And the courtesy thing to do would be to have someone in your office or yourself type a transcript of it and then provide that and say, this is the typed version of the attached handwritten document, so that the doctor can quickly and easily digest what's there instead of having to break out their microscope and try and decipher it painstakingly themselves. It's a real pain. Here we go.
Ah, yes. Yeah, just emphasising the need for pre-incident medical records. If they're not there, then we just can't proffer a definitive opinion on causation, which is what the insurance company wants. So if there's none there, you've got to make an effort to get them and prove you made an effort to get them. For instance, a lot of patients had all their work done in Iran or Iraq or in Vietnam, for instance, and they just can't get their records. Well, in that case, I'm entitled to make my assessment of causation on what I see, and the court will accept that. But the court will need to know that effort has been made to get the pre-incident X-rays and records. Ensure them. Yeah, so it's good if you can interview the claimant yourself and say, do you have any history of injuries? And if they do, then you say, well, you'll just have to get those records before we can present it to the expert. And it should make sure that they bring their X-rays. If they've got X-rays, some of them do have a nice file of X-rays with them, but unless they know they're going to see a dentist, unless they've been advised that you must take your X-rays, they never do. So that all helps.
Absolutely.
On the clinical records too, a lot of doctors and dentists, when they submit their clinical records, there's no name of the dentist. Sometimes there's no name of the patient because they've just taken it out of the patient's folder. So you have to check all records, make sure there's the name of the doctor, dentist, and patient, as well as all the dates.
Yeah, absolutely. Big one there. Okay, so this is where I touched on before. Use your photocopier to enlarge things if they're not clear. And that goes, sometimes you will have scanned or photocopied documents as part of it. And the more something is copied and scanned, the blurrier and crappier it gets. So when that's the case, you can use your photocopier to try and tighten the image. You can expand the image. You can contact the provider of that document and ask them to provide you with a better copy. Or, as I say, get a typist in your office or somebody to type up the content of it, label it transcript of blurry document attached, so that as a courtesy, the specialist can properly access and assess that information.
And what I'm seeing more and more of lately is people are taking photos with their mobile phones of documents, and they're not even flattening it out so that it appears flat.
Oh, yeah.
Then you get the shadows involved, and it's just useless.
Yeah, really hard. Here we go. This is
just for some entertainment. Is a classic case of how I really did need the pre-incident dental records, because this claimant claimed that tooth was broken in a recent car accident. But even lay people can see that that tooth has been set back. It's behind the canine on the left, and it's behind the tooth on the right, and it's going to be very difficult for anything to get in there and break that tooth. But you can see how it's a totally different colour. It's all yellow and old, and so I refused to make an opinion on that until I got the pre-incident records, and there it was. It had been it got bad decay because the patient couldn't clean it 20 years ago. It had several fillings. All the fillings fell apart. It finally needed root canal therapy and a crown. Then it got decay under the crown, and the whole thing fell apart, and then she didn't bother getting anything else done. Until the car accident, the lawyer said, "Oh, we may as well get your tooth fixed too," because she did have a facial injury.
Yes, we do catch these ones out.
By getting the x-rays from before and after, I was able to say, no, that was like that before the accident.
Here's another one.
Here's another one. This is an x-ray pre-incident of a car accident where the patient claimed that the teeth were broken as a result of the accident, claiming that they hit the steering wheel. Well, all the evidence was against that sort of an accident because it was a T-bone accident, and the patient hit the side of her head and not the front. So when I got a call for the pre-incident x-rays, there it was there. They were totally filled and decayed and on their last legs, and they would have required the claimed treatment regardless of any motor accident or any trauma.
Good work. Very good work.
Oh yeah, WPI, whole person impairment. It's very difficult to get any compensation because the WPI has to be assessed after treatment is complete. So most patients are returned to pretty much near normal. And because they're functioning okay, WPI is based on function. They don't get it. They're almost very disappointed that, you know, I don't think the system's fair myself, because if you lose a tooth, you lose a tooth. Just because the dentist has been able to put an implant back there and that you can eat okay, you've still had an injury and an impairment, in my view. But unless you're totally confined to soft food, for instance, you can't get it up to 10%. And the other thing is pain is not considered. You know, patients have had their teeth all fixed, but and they have the best possible treatment, but they still have pain when they eat. That's not to be considered because it's a functional thing. They can still eat, but it hurts. Well, to me, that's a disability impairment.
Yeah, absolutely.
But the way the rules are at the moment, you can't get compensated for having pain. And I've been an assessor for well, it's now the PIC, not the Motor Accidents Authority and Work Cover. And there's only 6 times in 10 years that I was able to get it over more than 10%.
Wow.
And most of those patients had lockjaw as a result of a very bad whiplash in car accidents.
Goodness me, that's scary. Okay, look, we've got a couple of other things just to be mindful of in relation to letters of instruction and the brief that you provide to specialists. If your matter gets rescheduled to another specialist for whatever reason, and sometimes this happens, you've booked it with Dr. Smith and all of a sudden Dr. Smith is unavailable or is sick or whatever, and we have to reschedule to another doctor. As a professional courtesy, the ideal thing to do is to reissue a fresh letter of instruction properly addressed to the new specialist. It's just a small professional courtesy. And from a legal standpoint, in a law firm, you would always do that to an instructing barrister. If a new barrister came along, you wouldn't just cross out Barrister Smith and handwrite Barrister Jones and give it to Jones. You would do a new letter for Barrister Jones. It's the same professional courtesy and respect for a specialist. If you need to amend your original letter of instruction or referral, when you send the new one to the provider or to the specialist, please clearly mark it as an amended LOI. There's 2 reasons for this. And the first is so that if it's a provider like us, like MAG, We know to remove the original LOI and place it in a different part of the record that the specialist will see. We also need to know so that we can make it clear to the specialist, stop referring to the original document we gave you, there is now a new one. And it also means that the specialist will not continue to answer the questions in your original LOI and provide you a report based on the original one. It means that they know to address the new one. The other thing that is also a major bugbear for doctors, you've provided your brief, you've provided your LOI, and the assessment took place yesterday afternoon. And then all of a sudden today or tomorrow, you provide a whole batch of more documents and say, oh, can Dr. So-and-so just take this into account? He assessed my client the other day. Well, no, they can't. It's really inconvenient. It's not in keeping with the whole concept of the IME examination and assessment. So the specialist has pre-prepared in most cases and has used that information as part of their examination and assessment of the person on the day. They can't be expected to then take into account additional information provided after the fact that they can't run by the claimant, that they can't consider and assess again with that person. It's appropriate that that information forms a supplementary report request. Furthermore, not all doctors will accept documents after the fact. Very few will these days.
Well, the point is that the expert hasn't prepared the questions to include the new information. For instance, I might get a case where the front teeth were damaged in a car accident. I focus on the front teeth. After I've almost completed the report, a new bundle comes in saying they hurt their back teeth as well. Well, not only could I not do it, I had to get the patient back and have another look.
Yeah,
because I didn't have the X-rays for the back teeth.
Yeah, exactly. It's just a sort of an inconvenience. And here we go, a little bit of common sense. If you're going away and a matter that you have been handling has an assessment that's going to happen while you are away, let the provider know, or the medical practitioner and their PA if you're dealing directly with the doctor. Let us know. My name's Steve. I'm handling the Jones matter. Dr. Smith is going to be assessing this tomorrow, but I'll be away for 2 weeks. In my absence, please make sure that you communicate with my colleague, Louise. That way we can update our records. And if there's anything urgent, Louise has been authorised by you to make decisions, to receive the report, to receive any inquiries, and we know who to send it to. It often happens that we will get a case manager or lawyer ringing us up and saying, I'm still waiting on the report for my claimant, Mr. Smith, that Paul Nichols was supposed to do. And we will look it up and we'll find out that Dr. Nichols actually provided that report 2 weeks ago to the person who made the booking. But we haven't been told that that person has left the firm, moved on, or is on holiday. Now, legally, we can't normally re-release reports to anyone who rings up. So we then need to get some kind of authorisation from the firm or from the insurer to approve us to release the report to a second contact. So if we had been told in advance that someone was going to be away, that issue wouldn't happen. Similarly, if you cease working on a matter and hand it to someone else, let us know. And remember to tell your worker that they have an assessment coming up. Often these things are booked quite in advance. And we know that insurers in particular, case managers can have a very high caseload. But set yourself a reminder in your calendar or whatever app you're using at work, and you booked that appointment 4 months ago, but it's happening next week. Ring your claimant or worker and remind them of the upcoming assessment. We see so many instances where the doctor rings us and says, this person hasn't turned up and I want to charge a cancellation fee. That could be avoided if the person was reminded. I know that we send reminder emails out to you, and it should be up to the lawyer or case manager to forward that information on and keep your client in the loop.
Exactly, yeah, very good.
You should also remind your injured worker or claimant or client that if they have any issues about the appointment, they need to contact you. They need to go back to you and say, I don't think I can attend. I need this rescheduled. The provider can't reschedule an appointment without your approval. We also get a lot of instances where the injured worker, client or claimant will send us documents and say, I gave these to my lawyer or case manager, but they told me they didn't want them, but I want the doctor to consider these. Now, we will always contact you when that happens, but you need to also be communicating with your client to let them know that you are their touch point, that you will coordinate all issues. Our job as the provider is just to find the appointment for you, book the appointment and liaise with the doctor and make sure that we get the report to you on time. We can't take any part of case management or client management ourselves. It's just not appropriate, and it detracts from the independence of the provider and the independence of the specialist.
Also, too, if the appointment has been made 3 months in advance, ring the expert's office 2 weeks before just to make sure that the secretary hasn't double booked or it's been lost or the computers went down and it's all a mess.
If you're going direct to the specialist, that's probably a very good idea. So, guys, look, I hope that this has been useful to you, and we're both here to answer questions if you'd like. It's basically a 50-50 partnership, the specialist and the client, and our client is you from MAG. So a great LOI or referral document is the best way to get a great report from your doctor. As long as you are clear on what you've provided and what you're asking for, the specialist is guided by that information and they'll give you what you want. So thank you again very much for joining Dr. Paul Nichols and myself. If you have some questions, you can unmute yourself and fire away.
We're all going to sleep.
Okay, well, if you don't have any questions,
okay, so the bottom line is get those LOIs in 2 weeks in advance if you can, but the very worst 1 week that we can prepare.
Terrific. And thank you to the person who said it was a great presentation. Thank you all for listening, and I hope that you share this particularly with new junior lawyers, new case managers, just some things that we don't always get to think of in these very busy, high-pressure times. Thank you all and have a great rest of the day.
What's slides? Can they have slides?
Yes. The slides will be sent to you within a day along with the recording of this presentation. And of course, you can always view the recording via your MAG login to the platform. Using the menu bar on the left, you can click on seminars and it opens up our YouTube channel, or you can do a good old Google search, YouTube Medico-Legal Assessments Group, and then you will see all of our presentations. There are several hundred of them, and I would draw your attention to the previous presentation by Dr. Nichols here on this topic, which had some pretty hairy dental images in there as well. Thank you again and have a great day, everybody.
Cheerio.